that's really what PACE will do. We manage all their medical care, whether that's from prescriptions to equipment to procedures, doctor visits, whatever they need medically to stay living at home.
Welcome to The Conversation, where we explore the people, programs, and ideas shaping life here in Northern Michigan. I'm your host, Christal Frost. And today we're talking about something that touches nearly every family at some point: caring for our aging loved ones. Navigating senior services can feel overwhelming, confusing, and often unmanageable, especially when you're helping someone maintain dignity, independence, and safety. And that's where PACE North comes in. PACE stands for Program of All-Inclusive Care for the Elderly, and it's a model that wraps medical, social, and supportive services together under one roof, helping older adults stay in their homes and communities longer and with a better quality of life. And joining me today is Community Outreach Director Lori Wells, who has spent more than 30 years in senior services and serves on the State Advisory Council on Aging. That's a 40-member statewide group that identifies needs, gaps, and advocates directly to the governor for supports benefiting older adults. And joining Lori is Executive Director Nicole Farkas, who brings over 20 years of RN experience ranging from oncology to mental health and home and community-based services. Nicole is currently on the PACE Association Michigan Board of Directors. Well, we're going to dig into what PACE is and what it isn't, what families don't know they have access to, and how to make sense of all of that system that can feel pretty overwhelming. Nicole and Lori, thank you so much and welcome to The Conversation.
Thank you.
Thanks for having us.
Super excited to have you both here today. I mean, first of all, can I just say thank you for your years of experience working not only with this population, but literally people in general. And I have such respect for people who can work as a nurse, people who work in home health. I mean, it's just unbelievable.
Yeah, I feel like I'm the cheerleader for all of those people out in the community saying what a wonderful job they do. I've never been a direct caregiver myself, but advocating for them is quite the honor.
And yeah, I mean, for you to go from that world into this world of now managing as the executive director of PACE, that had to be a change.
You know, it was. I still, like Lori mentioned, I have always felt that it's an honor to walk alongside people at a challenging time in their life.
Yeah.
A bit of a sacred privilege. So whether I'm bedside or behind a desk, I feel like it's still the same mission.
You know, and speaking of that mission, I want to talk about PACE North. I remember when PACE was just an idea. I remember actually going to a fundraiser, and it was this idea that made so much sense, right? Like, yeah, let's keep people at home for as long as we can, right? Safely. Maintain that dignity, that independence. And that is the number one thing that I hear from people, that they just don't want to lose that. And so here we are, 6 years later?
We're in our 6th year. Yeah.
It is going strong. But for those who may not have heard of PACE, can you give us maybe, a simple everyday explanation? What is PACE North, and what do you do for the older adults in Northern Michigan? Who wants to take this one?
Well, it's kind of easier to say what we don't do.
Okay.
One of our favorite sayings is, with PACE, anything is possible.
Love it.
But I like to say that PACE is an acronym, not a word. So it stands for Program of All-Inclusive Care for the Elderly, like you said. So we're a wraparound service. We take care of the person on their whole, what they need medically. And we're a medical program. So we coordinate all their medical care, whether that's from prescriptions to equipment to procedures, doctor visits, whatever they need medically to stay living at home. And I love what you said earlier about maintaining dignity, because that's really what's most important to us. We want to stay home, and some people will say that we need to do that safely. Well, your idea of safe and my idea of safe might be totally different, but I want to be home, and I want people to respect that decision that I have made and give me what I need in order to make that happen. And that's really what PACE will do, is walk alongside, like Nicole had mentioned earlier, walk alongside the family, along the participant, and make sure that their care needs are met so that they can stay living at home.
I love that you talked about the dignity of risk. With PACE, everybody has a different care plan. So that's what's hard with, what is PACE? It depends on what the person needs it to be. Not everybody has the same care plan. Some people might come to the center, some people might not. Different services are available depending on their need. But I think what's one of the things that has become really important to me is allowing people that dignity of risk. You know, I think sometimes as family members, you know, we look at our parents and want them to be safe, and that word safe comes before almost anything else. And in reality, if you asked me, would I rather be safe or take a little bit of risk and live at home? I would rather take a little bit of risk. So I'm interested to see where the conversation goes today, if we can share a little bit more about what that looks like.
Oh, absolutely. Before we dive into that, like what counties do you serve? I know you're in 7 counties right now.
Yeah, 7 counties. So Antrim, Benzie, Grand Traverse, Kalkaska, Leelanau, Manistee, and Wexford.
Okay.
I see them in alphabetical order, so I make sure I don't forget them.
Very good.
Right. So we serve all of those counties except for Antrim and Manistee. We serve parts of each of those counties. So our service area is defined by the state, and it's, you know, kind of loosely geared toward making sure that participants don't spend more than an hour on a bus to get to and from the center. So it's kind of like drawing a map, and that's how they come up with that. So right now we serve the southern part of Antrim County and the northeastern part of Manistee County.
And, you know, you were mentioning some of the services. You mentioned the center and then the home-based stuff. And I know we're going to kind of get into that a little bit. But as PACE is described as helping people stay in their homes longer, what does it actually look like when you're doing that?
Wow, that's a loaded question.
I know it's going to look different based on your care plan. It looks different
for everybody, because you think of just how you and I live, and what it looks like in my home and what it looks like in your home are 2 different things. And your morning routine and my morning routine are different. So what care looks like for an aging person still at home is also going to look different. So we'll make up a story about, you know, our average Joe. He might need somebody to come in the morning to kind of get him up and going. He might need a little bit of help getting dressed or some meal prep or something. And then he might come into the center that day. He might get physical therapy while he's at the center. He might play a game of bingo and see his friends and have a nice hot lunch. Some of our folks get showered at the center if they don't have appropriate shower facilities at home. But like you said, most of the care happens at home. Even if people come into the center 5 days a week, you know, there's still nights and weekends. So a lot of the care is just making sure they have what they need to be safe. It might be a lifeline button. It might be home care. Where we have a telehealth program. So in some cases where people need extra nursing support, a nurse might reach out to make sure that their care is going well. Sometimes it's medication prompting or a med wheel. There's a lot of different ways that we can meet those needs.
You know, one of the things, too, that I think really is special about PACE is that, you know, it's called, you know, care for the elderly. Although I am going to say, as someone who's getting closer to 50 every day, it's not necessarily. It's 55 and over,
I'm
right?
60, and elderly would be not a word I would use to describe myself.
Yes.
So I love that it starts at 55 because so many programs out, you know, they're start at 60. And unfortunately, more and more we're seeing people dealing with some chronic conditions or some acute onsets of debilitating things like strokes or early onset Alzheimer's or Parkinson's or MS that could put the person in a nursing home because of the support that they need. And the fact that we start at 55 really does fill a big gap of 5 years that other services might not be able to help them.
Yeah, that is amazing. One thing that you sent an email about, Lori, and I just have to mention this. It really hit home for me because I am in the world of marketing, right? And you mentioned that there are so many services that are available for seniors, but most people really don't know about them and they don't know how to access them. Why do you think the system is so hard to navigate? And what do you think the biggest gaps are for these older adults? And not just them, but their caregivers. So let's start with that first one. Nicole, what do you think? Why do you think it's so hard to navigate this system?
Well, I know Lori and I often talk of how it shouldn't be. It just shouldn't be that hard. There's a lot of efforts going on right now to bridge those gaps. But I think there's different organizations that offer different things. So I think anytime when you have a lot of players offering services, you know, they each have their own contact information on how to get a hold of them. I think most of us, I know PACE and others that we work with, if we're not a good fit for that person, we do refer them to other places. But I think it's just the number of players and.
Yeah, I think that's part of it. I think the other real reason is because most of us don't want to admit that we need help. And so therefore we turn the channel if something comes on TV because, oh, that's not me. Kind of talking about it makes it more real and don't want to talk about it. And if you were to ask me, like, what is childcare like in this area, I would have no idea because I don't need childcare. So I don't pay attention to the things that are out there. So I think it's very similar with elder care that people think, oh, I don't need that yet. I'm never going to a nursing home, so therefore I'm never getting any help.
Right.
It's like there's a lot of things out there prior to needing nursing home care that people can get support. And our Commission on Agings in each of our counties are so strong, and it's just kind of befuddles me why more people don't use those services because those are kind of like your entryway into senior services are your Commission on Agings or your senior centers. And, what do we have? I think in Grand Traverse County, there's like 22,000. There's probably more than that now, 24,000 people over 60.
Wow.
So to me, that should mean that the Commission on Aging is serving 25,000 people because they're old enough and they all need something.
Right.
We all need something. So just trying, that's kind of my big passion of navigating or helping people navigate services is just making sure people know there's things out there and just to reach out, find out what's there. Maybe you don't need anything right now, but know what's there. So when you do need something, you can connect with them.
And PACE is, obviously it's for the older adult, right? But it's also for the family. And I think about this a lot because, obviously as people start to get older, sometimes they're getting older at different rates, if you will. So you might have a very
different paces.
Paces, thank you. Different. It was right there. It was right there.
So funny
to you.
But you might be getting older at different paces. So you might have someone, a couple, and one is very still active and vibrant, and maybe doesn't need the level of care as another one does, but also can't necessarily be that person's full-time caregiver. So that's a real thing that happens. I think more and more than people are aware of, right?
That's usually how it happens, frankly. I mean, I have a skit that I put together that I took around the circuit and did at the senior centers and kind of showing, the husband and wife playing, they're pickleball players and they're playing pickleball. And the wife falls, breaks a hip. Now she has physical limitations and needs help. And the husband doesn't want his pickleball schedule interrupted because he needs help during that. Or some cognition issues coming on, and the person who's taking care of them needs support so they can keep themselves strong and keep themselves part of the community. You never need the same things at the same time. It never goes that way.
Or you have, maybe a child that's, checking in or living at points or times with the family member. And again, like this idea for full-time caregiving is just not something that they can do.
I think one way people can help themselves the most is to reach out sooner. I mean, if you're sitting at home right now thinking, oh, I might have to do that someday, you probably need to do it now. I mean, the best way to avoid burnout is to get help before you're burned out.
Yeah.
And people never think they're burned out until they are.
Yeah.
And then it feels like the only solution is to have them move somewhere else because it's just too much.
Oh boy, yeah. And is that what you would say, Nicole? Like you wish every family knew that asking for help right now doesn't mean that, that is the end. That, you're not going to help with the caregiving or that you're just giving up. You're just asking for a little support.
Absolutely. And getting help sooner allows you to be a caregiver longer. And I know for programs like PACE, we partner with the family or caregiver if there is one. So whatever that person wants to continue to do, we don't come in and just take over. If they still want to make mom dinner on Wednesday nights, that's great. But I would encourage them to just go and be the daughter and let somebody else deal with the meal, unless that's something that, is super special to them. I don't know about you.
Yeah, I mean, I hear every day, which breaks my heart, especially since I'm in the marketing of PACE, that people say, wish we'd heard about this a year ago or 2 years ago, and that just stabs me in the heart because it's just like, oh, I miss them. How did I miss them? But I do feel like that people just are not in tune to looking for help, so therefore they're not paying attention to the services when it does cross their paths.
Do you think that there is something, and especially I think in older generations, there is a pride factor and there is this real sense of not wanting to feel like a burden. And do you think that that sometimes is a reason why people are just, nope, I can do it. I can handle it on my own?
100%.
Yeah. Yeah.
Absolutely.
Especially the men. The husbands feel like the wife has taken care of me my whole life. It's now my duty to take care of her. The number of times that I've had those conversations, the men really struggle with letting other people come in because they feel like they're supposed to do it on their own. And I should look up the statistic, and I know that it's out there, just the number of caregivers who actually pass away prior to the person that they're taking care of is very high.
Yeah.
And unacceptable because people literally kill themselves trying to take care of a loved one, and it doesn't have to be that way.
And you mentioned something, Nicole, that, when you have support through PACE or another program, you get to just be the daughter. You get to just be the wife. Yes, of course, maybe you're still going to help with some of the things here and there, but that is one thing that I think happens in families where it's almost as though you don't get the time to spend, or to, even if someone does have a debilitating illness, to grieve, because you're so busy with the schedule and going from day to day to day that you just kind of say, oh my goodness, where did those last 2 years go?
Well, and what if you didn't have, when you go to visit your dad, if you didn't have to read through all of his mail and return some calls and
Clean the bathroom, and empty the garbage, fill his pill boxes.
And instead you got to just sit down and visit and talk about what's going on in the neighborhood.
And I mean, my dad, who is definitely watching right now, I got to tell you, he watches religiously. I love it.
Call in, Dad.
Hi, Dad.
He loves watching old Westerns and Bonanza. And when I visit,
that's what happens when you retire.
That's what you want to watch, I want to just sit there and watch little Joe and watch that with him, instead of, what do you need? Do you need something else? Okay. Do we need to use, that's really special. It is.
Yeah, I was talking to a family just today, actually, that the husband is caring for the wife who has dementia. And I was mentioning how we could maybe bring her to the center. And when she comes to the center, we could do the shower and wash her hair, and she'd have a hot lunch, and she'd be busy with activities all day. So the idea is that she'll come home, she'll be clean, she'll be full, she'll be tired, she'll rest, and you can have a good night's rest. And the relief the look on his face when I said that, I knew it just really struck a nerve with him, because he was like this huge sigh of, that would be great.
We have to talk about the center and some of the other things in this wraparound care. And that is one thing I think that makes PACE unique. It is the wraparound care. It's everything from the transportation, the medical care. You're talking about the therapies. You mentioned maybe you're going to do, physical therapy while you're at the center. The meals, the home modifications. You also have that social connection. That is a piece that is so vitally important for people. I just want to ask about that center. A while ago, I did a tour of it, and it was mind blowing. I was like, what is this place? It was amazing. It is a powerful hub. And so if you are going to the center, and Nicole, I'm going to ask you this too, because you're going to say, well, it's going to be different based on each person, right? But what does that look like? When I walked into the center, I remember doing a tour, and I saw some people playing bingo or playing cards. I mean, there was definitely a vibrant activity, things going on. And then you definitely saw other rooms and where other things were happening. So what does it look like at the center?
I mean, I would like to think of it a little bit like the TV show Cheers, that when you walk in, people go, Norm.
Yeah, that's a thing.
They know you.
Right. Not only does the team members who work there know you, but the other participants that go there with you, you really get close to some of them if you choose to. And they miss each other if they're not there that day, and look out for each other. And it's a support group. It's people your own age to talk with and have a good time and reminisce. And so I think that's part of the connection, is just being known and knowing other people.
Yeah, that's a big part.
And it's really, reminds us that it's a small town. They get there and they see faces that they know, or they start talking and they have family members that, connections that they know each other. We had two ladies that used to be best friend neighbors. They raised their children next door to each other, and they hadn't seen each other in a long time. It was 20 plus years. And they actually ended up sitting at a table together one day and realized who each other was.
Oh my gosh.
I got a picture of the two of them smiling and hugging. And I just thought, So
that is so
neat.
sweet.
So yeah, so I mean that can happen to all of us if we just talk to each other, right? So
Right.
But the fact that they have a controlled environment where they can do that is just
And there's a
very
lot of
satisfying.
activities. People can choose to participate, but they don't have to. And there are some outings. Lori's done a few cool outings this year, so it gives people a chance to go shopping that maybe don't normally get out. Or we did a color tour out on the peninsula. So it just gives an opportunity to get out and about too.
You know, you're talking about the choice element as well, which I think is just kind of the thread that is woven through everything with PACE. It's the choice to stay home. It's the choice to go to the center, to participate if you want. And that in itself, that choice, that is restoring dignity, right?
It absolutely.
Yeah. So the transportation, that's a huge thing. I'm thinking about families right now, and maybe someone is still working. And so, you know, they want to make sure that, you know, not only is their loved one safe, but that they're being entertained, that they're not just sitting back by themselves all day. How does that factor in? Because that can be a huge barrier.
Yes, transportation. I mean, we provide medical transportation. So truly, when I worked at the senior center all those years, I would get so many phone calls from people that didn't drive, that needed a ride to get, you know, glaucoma surgery, or they had to have somebody stay with them because they couldn't be alone for a few hours afterwards, or just getting to doctor's appointments. So I know when you talk to different doctor's offices, the rate of cancellation of appointments is so high because people just can't get there. And so a leading indicator for us is people will call us just wanting a ride. They see our buses, because we have like 17 buses on the road. So, you know, I saw your bus. And so a lot of people will call asking just for a ride, and, you know, would find out it's not an a la carte thing. It's like, you have to take all of us or none of us. But, you know, most often we're able to say, well, but do you also need this and maybe that and maybe this? Well, maybe. And so, you know, find out they do have more needs than they even realize. But that transportation is a leading indicator. And I love our public transportation. Beta is fabulous. The WEX Express is fabulous. The Benzie bus is fabulous. So like all of that is really wonderful. The difference for like people who are part of PACE is we're going to help them schedule those appointments. We're going to get them to them. If they need to get blood work first, we're going to go do that first and then take them to their appointment. Or, you know, like all those little, if you're a caregiver and have ever had to do that with a family member, it's a full-time job to manage those appointments and manage those ancillary services that are necessary in order to even get to that appointment.
Yeah, very true.
So we take care of all that.
Now, Lori, since you serve on the State Advisory Council on Aging, that is a very important piece of the puzzle, and you're giving perspective on what seniors are facing statewide. So it's not just here in the 7 counties that you serve. What are the trends and the challenges that you're seeing across Michigan when it comes to serving our older adult population?
Well, oddly enough, they're pretty similar. They are transportation, housing, and respite care for caregivers. Those seem to be the top priorities. That is very frustrating to me as an advocate for seniors, because those were the same issues that were issues 30 years ago. I still have papers in my desk where let's talk about what do seniors need. It's like we have not figured out in 30 years, you know, how to do that. But part of what I love about working with PACE is our PACE participants all have a place to live. They all have the transportation that they need. And, you know, we provide the respite support for them. So if you're in a supported program like this, those are not needs of people that are necessarily in PACE.
Right.
But for our general population, it's scary. The lack of housing, affordable housing for older adults. Many of our seniors are getting, you know, kind of kicked out of these apartments that they may have been in that are being converted into Airbnbs or short-term rentals of some sort, or just rents that are going through the roof. Some of our mobile home parks that were affordable back in the day. The lot rent alone is more than what people make in a month. So that's those are not affordable for older adults anymore. So housing is very scary for older adults.
And while, you know, some of our participants are impacted by that, but one of the nice things with our care management team, I think people kind of struggle to know what care management is, but it's that type of thing. If they start having issues with housing, we have social workers who will step in. They might help you fill out applications for other complexes. They know what resources are in town. And they do a lot of that legwork for you. So they're kind of a partner. So you're not just kind of floundering on your own.
Really, truly wraparound. Like if you're encountering something that could mean that you're not going to have housing. You actually have social workers that'll help people.
Right.
Wow, that's huge.
It's very huge. Those social workers are dealing with all the things that are not necessarily medical, but impact your ability to live at home.
You know, and I know that this is not going to surprise anyone, but in these 7 counties, and particularly in Grand Traverse and Leelanau County, and I would say particularly Leelanau County, we have a very aging population right now. I think, what is it?
Aren't they the oldest county?
The oldest county
Michigan?
in the state, and the average age being like 55 or something. It's truly like, you know, a wonderful thing, but at the same time, you think about all the needs. And then we realize that not everyone, even if they did want to go into a nursing home, we wouldn't have space for everyone to go into a nursing home. So how often are you thinking, you know, you having people who do, yes, want to stay home, but also sometimes it's, I just don't have another choice and I need to make sure that this is going to be, you know, a good choice for me to stay home. Is that happening a lot?
I think overall there are nursing home beds available. Sometimes not. I mean, sometimes when we're discharging somebody from a hospital and they require some rehab or longer stay, sometimes it is hard to find a bed. And I think there are people that are on wait lists for, especially if they want to a specific home that they're waiting to get into.
Yeah, you don't really have a lot of choice when you're in the hospital. If you need to go to a nursing home, it's kind of who has an opening.
Right.
Because it isn't usually that they all do.
Yeah.
I think, you know, the trend that I'm seeing all the years of being in this town particularly is just we have an abundance of assisted living facilities that are kind of high for people with lots of income to support that.
Yes.
That's not the population that we're serving.
Sure.
Those places are not places that our people can go to. So we're looking for, we have a decrease in adult foster care homes. That's where a lot of our, participants might be requiring help. But those high-end assisted living places are not meeting the need of our participants.
And, if you're ever in a room of people, regardless of the age group, and you ask people to raise their hands if they want to go into a nursing home, I've yet to be in a room where one person raised their hand. And obviously we have wonderful nursing homes in our community and we partner with them. And there may be a time when that's necessary, but honestly, it's not the goal of anyone that I've ever spoken with. And so like we talked about earlier, it's asking for help before you to a point that there are less resources.
Not to bring up my dad again, but that is where my brain goes when we have these conversations.
Right.
When he did have to, say after a hospital stay or after a surgery or something, you have to go to a nursing home. The interesting thing about that is that the only thing that he liked about that was the socialization. So that is the thing that
Some people flourish.
Yes. And they, I remember going to visit him at dinner. And he had a whole, it was like holding court. He had a whole group of people around. He's telling stories. And that, I think, is the real beauty of the Center for PACE, though, is that's what happens. That piece, that socialization piece that maybe you do like at the times that you have to go to an assisted living facility, that's there, but you get to go home at night.
Go home at night.
Yeah.
Yeah, what's familiar. Yep. Well, and healthcare has changed so much, too, because I'm so older now. Have seen a lot of change, but I started my career almost 40 years ago in a nursing home world. And the nursing home then were the people that are now living independently. Hospitals are releasing older adults so much quicker than they used to. So they're discharging folks to nursing homes who require very intense treatment.
Yeah.
Very high acuity level, have a lot of care needs to a nursing home. And so people that used to be in nursing homes are now going, living more independently with help in the home or going into some sort of assisted living. And so the reality is the nursing homes, like you said, don't have room for people who have moderate care needs.
Sure.
So you have to start thinking about outside of that box, what that looks like.
And the best way to stay, if you're not somebody who wants to live in a nursing home or even assisted living, the best way to avoid that is to not go to the hospital.
Right.
And that's, I think, where PACE does a really nice job of symptom control and that care management to talk through. We have advanced care planning sessions with our providers there, and they help with goal setting and talk through, what do we need to do to keep you out of the hospital.
Right. So I have to get into Mythbusters at this point, okay? Because what are people getting wrong about PACE right now? I think there are a few myths that are floating around. For example, it's only for people in crisis, right? Or that you have to give up your current doctors or some of those things. What do you think are the biggest misconceptions that you'd like to take this time to clear up about PACE?
Well, I'll address a couple of them. One, that you have to come to the center. So not everybody is lacking socialization.
Sure.
Right?
Yeah.
So a lot of our older adults are living with the kids and the grandkids, or they're going to the senior center. Some of our participants drive themselves to our center. So socialization is not an unmet need for everyone. So some people, the idea of like having to come to the center,
They don't
have
want to do
come
that.
to the center. You're going to come to the center if you have an appointment with a provider at the center, or you're going to come there if you maybe are going to get some therapy there, but even that can be provided in the home. So that's that'd be I feel like our number one myth. The other one, as far as giving up the provider, so PACE does become your primary care provider, and so that's an obstacle sometimes. Although we can work with people's current providers to allow them to still see them a couple of times if they like just want to kind of get their approval of, hey, they're doing this. Does that sound all right?
Yeah.
We call them social visits. So that can happen if necessary, but you know, for the most part, especially people in this area are keeping their specialists because there's only so many specialists around. So it's not like there's a lot of choices. And we go through all that before they would sign on with PACE to make sure they understand which doctors they would keep and which ones they would have to have closer to home. And if it's changed, just because it makes sense for it to change, right? If we're providing that transportation, we're not going to send a bus to Manistee and take them across the street to the doctor. You know, we're going to bring them to the center where they're going to get multiple services taken care of and kind of make it an all in one day.
Yeah, that makes a lot of sense. What about the cost component? Is there a cost component for families that, you know, that they need to know about?
Most of our participants have Medicare and Medicaid.
Oh, okay.
And in that case, there is zero cost, no copays, no deductibles. Everything is covered, whether you are in ICU or you need whatever piece of equipment.
Wow.
100%, including dentures, hearing aids, everything.
Wow.
It's huge. That's a huge thing for
There
people.
are some people who maybe have Medicare but don't qualify for Medicaid. One, I would encourage you to reach out because I think a lot of people don't think they qualify, and they do, and our team can help with that. We have a wonderful intake person who does a great job helping people apply for Medicaid. But people are able to private pay as well. And obviously there's a cost to that. But if you're somebody who wants to stay home, but is feeling like, gosh, my only option might be assisted living, I would say that PACE would be cheaper than assisted living. And then the rest of your healthcare is included.
Wow.
Yeah, that's a really big deal. And Medicaid made some huge changes this past year that especially with the asset limits, used to be $2,000. You could only have $2,000 in assets, and now it's almost $10,000. So, you know, really trying to get that message out to people because we unfortunately did have a lot of people that just couldn't apply for Medicaid and couldn't afford private pay.
Sure.
Or maybe now they would be eligible. And private pay, even for PACE, especially in this area, like money is not always the barrier to healthcare for a lot of our people up in this area. It's finding caregivers and having the ability to navigate services. So PACE is a perfect answer for those folks too. It's definitely more cost effective than going into assisted living. So if you want to live at home, you know, it's going to be cheaper for you, but more importantly, you're going to get all those wraparound services that you need in order to keep living wherever it is you're living.
Now, I know that we've talked about some human stories already, but this is my favorite. So before we close, I want to ask you about, you know, maybe you've seen how PACE has changed the trajectory of someone's life, whether it's a caregiver or it's, you know, a client that is getting services. Can you think of a story? And I know, Lori, you're going to be full of them.
I have a favorite one, but I don't know if you have a favorite one.
Did you want to think of a story to share about how PACE really did change someone's life?
The one that I would share is just that there was a gentleman who had, I want to say maybe it was hydrocephalus. He needed a shunt. And in order to have that surgery, he needed to have his blood sugar under control. And they couldn't get his blood sugar under control because he really had a needle phobia and wasn't mentally able to at that time due to all the cognitive things he had going on.
Which were caused by the not having a shunt.
Right.
And traditional insurance wouldn't pay for an Omnipod. It's a device that delivers insulin for you. you would have to go through all the steps of trying all the different types of insulin first, which he couldn't do. So because PACE, we are the health plan and the provider, we were able to just do that Omnipod. His blood sugars got under control. He got the care that he needed, and he is much more stable, living at home, feeling good. So from a medical standpoint, that was something really cool that we could do because of being the health plan. Lori,
he would say, he tells people we saved his life, and he was only in his 60s, so he's a young man. Totally changed his life for sure.
That was such a, I just saw all of your nursing background come through with that one. You were like, look what we did medically, and then it helped him, socially and everything else. It was amazing.
Yeah, because he was really, he tapped into all his family members. They'd all done as much as they could do. He was his cognition was suffering because of I'm not clinical, but because of the shunt and the buildup going on in his brain, but yet that couldn't get fixed because this couldn't get fixed. So it's just like, somebody just has to get in there.
And you did it.
And we did.
Well, what about you? What is one of your favorites?
So my favorite story happened during COVID. So it was one of my first participants that we helped, and she was a retired social worker, and she has MS, and she was in a nursing home. And during COVID, family couldn't visit. She couldn't visit. She was completely isolated. The son didn't lose his job, but it was on hold because of COVID. So he came home, couldn't even see his mom because it's COVID. So he couldn't even get into the nursing home to see his mom. And so he reached out to PACE, and we were able to move her back into her home.
Oh, wow.
And he was there so he could kind of help get her settled or whatever. Now he's gone back to, I think it's New York where he works. So he's back in New York. She's living independently in her home, and we're taking care of her, and she loves it. And she did not belong in a nursing home, and her life was going to be in the nursing home for the rest of her life.
She is gracing the cover of our latest brochure.
Yeah. Oh, I love it.
Yeah, I mean,
she's so full of life.
She's so full of life.
Wow.
Yeah, and just without her son advocating for her, without the opportunity to even have PACE in this community, I mean, the rest of her days were in a nursing home, and that would have been very sad.
So I want to make mention that, this episode is going to air just 3 days before Christmas. So you might be listening or watching at a different time, but it is the holidays. And a lot of us are going to be spending time at home with our parents, our grandparents. And for people who are listening and thinking, this might be something that might help my mom, or, how do I find out more information? First of all, what are some things that maybe you could look for to get an understanding of whether or not your loved one may need a little bit of help? I mean, is there something that you can maybe look for when you're visiting for the holidays and say, maybe you do need a little more help?
I think sometimes things that we notice as children of parents or grandchildren is it could be realizing that their meds are in disarray, or checking their pill box and seeing that it doesn't look like anything's been taken. It could be looking in the fridge and finding no food or super old, outdated food. Then you're kind of questioning what they've been eating.
Right.
Sometimes it's seeing some bumps and bruises and realizing that maybe they're having some falls. I don't know, Lori, if you can think of any.
Yeah, I'm sitting here. I'm starting to get tears in my eyes because for my personal experience, it was walking in the kitchen and asking my mother-in-law, "Where's the turkey?" Because we couldn't smell it, and we all had to go hunting for the turkey, and it was in the back room on top of the laundry.
Oh,
and she didn't know where it was.
Right.
And I was like, "Okay, yeah, this was a sign."
Those were signs,
right?
yeah.
And so, just when things don't feel right, I think in your gut, if it's your parents, you kind of know that things are.
Well, like we talked about earlier, it doesn't have to be to the point where there's screaming sirens. I mean, if you're just wanting to be proactive, reach out. If PACE isn't right at this time, then we can point you in the right direction for other sources.
And that's what you shared, that, so many families are saying, I wish I would have known this sooner. Well, sooner might be right now. Yeah. And maybe in a few years, you're going to be ahead of the game, right?
And if you're the family member and you're finding that you're doing a lot of things for your parents, that's one thing. So could they do it without you? That's a good question, I think, to ask yourself. If I didn't live here anymore, would they be all right? And if the answer is, I don't think so, then that's probably a good sign.
The holiday season and you're feeling super burned out because you took on the one more thing of getting ready for the holidays and you're sitting there in tears at home, that's also a good sign. You need support.
Well, how do people get that support? What's the first step? How do they get connected?
Yeah, so you certainly visit our website, pacenorth.org. Lots of good information on there. There's a refer now button on there. You just click that, type in your name, address, or name, phone number. We're going to reach out.
Oh, easy.
Very easy. Calling the PACE Center, of course, our main number is 231-252-2767, and ask to talk about enrollment. Then we come out to the home and bring information and just kind of talk about what's going on, what's happening, what's the situation. We'll try to arrange for a tour, bring them into the center to tour. We do a monthly open house on the first Thursday of the month, every month at 4:00. It's a great time to just gather some info, kind of check it out. And we then eventually have a nurse go to the home and see what services are necessary. But the first thing is just to reach out and learn more. And I would also appeal to the audience that might be working in medical facilities, either in doctor's office, any program where they're exposed to older adults. If you're working with people who are canceling appointments or can't get rides or messing up their medications, or we need to partner with our referring agencies out there, because you are who they trust.
Yeah.
And talking about navigating services, it has to start there, like wherever they're going. Like we need everybody to know that there are other options.
One of the things that I think we sort of glossed over, but I want to make sure we're hitting, is the home equipment, making sure that the home is equipped for certain things. And you mentioned, like, if there isn't a shower that someone can use. I mean, just these things, you've kind of thought of everything. But you can also refer out to different organizations that can outfit the home, right?
Yes. For some people who need a ramp now to get out of the home, Pace North will install a ramp.
Wow.
And then there's all the other different types of equipment, whether it's bedside commodes or shower benches or whatever the case may be.
Yeah, perfect.
Hospital beds, lift chairs.
Yeah.
Yeah. I have to say, I mean, I love having this conversation. I really admire both of you for the work that you do. It's truly incredible. And I believe 100%, Nicole, that, we get to walk beside people who are, as they're aging, and what a privilege that is, whether it's a loved one, a family member, or it's a friend, or this is the work that you do. I know there's a lot of people who work in this industry. So thank you all for the caregivers, for the people who are working in this industry. And big thanks to my guests, Nicole Farkas and Lori Wells, for joining me for another episode of The Conversation, and for everything you and the Pace North team do for older adults in Northern Michigan. Now, if you're listening and you want more information, or if you're caring for an aging parent or grandparent or a loved one or a spouse, partner, you can learn more at pacenorth.org. I'm Christal Frost, and this has been The Conversation. Thanks for being here, and we'll talk again soon.